go. All right. Okay. Hello, everyone. Welcome to Teneral Cellars Facebook Live. We are here with our lovely resident physician, Dr. Kara Quant. We love her, of course, as you can tell. So Teneral Cellars, if you are new to our platform, is a woman-owned, woman-operated wine brand, digital wine brand that is using wine as a conduit for change. And how we do that is we curate tons of conversations and content around issues that affect women in the world every day across the board, whether they're women in Afghanistan or the women right here in California where we are based. Teneral Cellars is based out of Fairplay, California, and we've been in existence about a year now. We just made our anniversary, actually.
Okay.
So yes, thank you. So we are super excited to keep these conversations going and to really bring more awareness to issues that affect women every day. And so with our current release, Healthy Women, Healthy World, we are doing just that by highlighting reproductive health, heart health, and breast health by donating proceeds from our 3-pack to the Endometriosis Foundation of America to help them fund more research and more resources for women who are experiencing endometriosis and other reproductive issues. And so today, Dr. Kara is here to talk to us about heart health and why it's important for women to be abreast on information about heart health and cardiovascular health.
I like that word. No pun intended, right?
Yeah.
Pun intended.
Yes, exactly. Abreast. if you missed it. But yeah, so that women, we are 1 in 3 women die every year from cardiovascular disease, and that needs to change. And we want to be a conduit for that change. And so today we're going to talk about the issues that affect us and why we have those things. But before we get to that, we're going to have our beautiful Dr. Kara Quant introduce herself and tell us a little bit about who she is and why she's here today.
Okay, well, thank you, OT, for that. I'm also on Instagram Live right now, so I'm like looking at 2 different screens. But hello to the people out there in Instagram land. But I am talking today about heart health with you guys, Teneral. Teneral Cellars. I have my wine bottle here, beautifully labeled. Yes, 1 of 3. And I also have my heart.
I love it.
So I am ready to have this discussion because it is a very important discussion about our hearts. I am an internal medicine physician. So for anyone that doesn't know what that is, I see patients 18 and over. I'm actually in a urgent care setting. And so I am seeing patients that are coming in with chest pain, coming in with heart issues, have already been diagnosed with cardiovascular disease. So I am well aware of all of the issues and ready to discuss ways that we can keep our hearts healthy. Because it is important. Like, our hearts keep us alive. If we don't have our heart, we will die. So,
yeah.
I mean, it sounds real obvious, but I think that there's some people that don't understand the value of their heart and keeping their heart healthy.
Absolutely. I would totally agree with that. And I think a lot of people, most of us probably don't think about our heart on a regular basis when we're, eating things that we know are not the best for us and drinking things that aren't the best for us. So I totally get that. So let's start off with, let's tell the people what cardiovascular disease is in general.
Okay, so cardiovascular disease is a kind of subset of diseases, but basically what it means is that there is some plaque buildup within the walls of the arteries of the heart. And not just the heart, other parts of the body. So in the brain, in the legs, in the other arteries, and basically arteries of the body. And so cardiovascular disease can be like the risk factors for it are the following. So high blood pressure is a real big risk factor for cardiovascular disease. High cholesterol, also another big one. Diabetes is a huge one. It's actually considered an independent risk factor for a heart attack. So if you don't have any other problems, if you don't have high blood pressure, high cholesterol, if you're normal weight, as long as you have diabetes, that can put you at risk alone for a heart attack. Smoking is another huge one that can affect the arteries of your heart. Obesity is also another big one. There's like a subset of diseases that kind of are incorporated into cardiovascular disease, but like the basic of it is just some plaque buildup of the arteries of the body, which includes the heart, the brain, and the extremities, or the arms and the legs.
Okay.
Yes.
I didn't know that.
Yes. So it is, very important to keep that in mind as we talk about, or as I talk about the different things relating to the heart. And so I have broken down this discussion to a couple different parts. One is how to keep our hearts healthy. So starting at the basics, how can we keep our hearts intact, keep them working fine? The next thing I'll do is kind of prevention, or what to talk about when you go to the doctor's office. The doctor will also, especially if you're going for a physical exam, the doctor will doctor or whoever you're seeing will do certain things, like take your blood pressure. The next step that I want to talk about is prevention, or what to talk about when you go to the doctor's office. And then the last thing that I want to discuss is what are the signs of a heart attack? Because that is also a big thing that a lot of people don't know, especially for women and men. There is a different presentation for women versus men. And I didn't even understand this until I got into medical school and actually even residency. So it is very important to hear this information. I actually have a story about someone that I love who actually did not know the signs of a heart attack or were having a heart attack. So wanted to also discuss that. Yeah.
Yes, please.
So, and then if you have any questions, OT, you could definitely ask me. If you want clarification, people on Instagram, if you want to ask questions, you can. So let's jump into it. So ways to keep your heart healthy. And a lot of people have probably already heard this information, but I want to stress it. Activity.
I like starting with the positive. Yes.
Starting with the positive.
Yes.
We start with the positive. So cardiovascular activity. So we all have to do some type of activity. According to the American Heart Association, which is a big society of people that bring together advice about the heart. So according to the American Heart Association, it's recommended 150 minutes of physical activity per week. That's moderate activity, or 75 minutes of vigorous activity. So what does that mean? So moderate activity is things like brisk walking, water aerobics, dancing, tennis.
I could do that.
Biking slowly, less than 10 miles per hour. So those are considered moderate activity. And I break it down and I tell my patients 30 minutes, 5 days a week. You can fit that in. Like, you can wake up early in the morning and do 30 minutes, walk before you go to work. You can do it during your lunch hour. They actually have a colleague who does that, who walks during lunchtime. Or in the evening time. There's ways to fit working out in. And a lot of people that I see are like, oh, well, I'm just so busy. You have to make time for yourself. Like, you can't make time for other, you have to give from a full cup. And I think that also includes activity, physical activity, keeping yourself well, keeping your heart healthy. So 150 minutes per week of moderate, 75 per minute, 75 of vigorous activity. So vigorous activity includes hiking uphill, running, aerobic dance like Zumba, jumping rope. So 75 minutes you could definitely do that per week. So
I want to go back to something you said.
Yeah.
You said, keeping our hearts healthy so that we could be from a full cup. And I think that is something particularly important for women to hear, because as women, as mothers, we tend to think that we need to put everybody else before us because, their health and all of that. But it's like, if you're not healthy and you're not strong, there's nothing you could do for other people. And so I'm happy you brought that up, because that is such an issue that I think a lot of women sit in by themselves and think I have to do it this way, or my world will not operate correctly. And it's like, you have seen nothing yet. If you're not healthy, the world really will not be, as cohesive as you want it to be. So thank you for bringing that up.
Exactly. Yeah. Yes. I totally understand that from women seeing patients on a regular women on a regular basis coming into the urgent care, not taking care of themselves, wanting to take care of other people, being caregivers for other people. Yep. Like, you really do have to take care of yourself before. I mean, just like on a plane, like you have the air, the oxygen mask on yourself before you put it on to the other person. The same when it comes to exercise. Yeah. So yeah, that's a big one. And we can all incorporate it. We can definitely incorporate it into our schedules, because you're worth it. Smoking cessation is another big one. And when I talked earlier about independent risk factors, this is also another independent risk factor for cardiovascular disease. So if someone smokes, and I'm talking about more than 100 cigarettes in their lifetime, if
you're a smoker, you're definitely doing that.
Yes, you are at increased risk of a heart attack. Again, if you don't have high blood pressure, not high cholesterol, if you're not obese, if you just smoke, you are at an increased risk of a heart attack compared to a person that doesn't smoke. And so I wanted to give you some statistics from the American Heart Association, because I think it's pretty astounding. So if you cut smoking, in the first 20 minutes, your blood pressure and your heart rate actually recover from the nicotine-induced spike. After 12 hours, the carbon monoxide levels in your blood actually return to normal. In 1 to 9 months, clear and deeper breathing gradually return, and you basically have less of a cough and shortness of breath. After 1 year, your risk of cardiovascular disease is reduced by 50%. Which is big. It's huge. You can cut
crazy.
Yeah, you can cut your risk factor in half by stopping smoking.
For just a year alone.
A year alone, yes.
And does that matter if you've been smoking for 30 years? Do you know if that applies? Or is
it matters if you've been smoking for 5 years, for 2 years, for 30 years, for 50 years. Your reduction of cardiovascular disease as well as lung cancer can reduce just by making that. And I know it's not just like a quick thing. Smokers have been doing it. This is a habit that's been built up. Nicotine is addictive, so it is not something that can be taken. It can be done easily, but I'm telling you, the effects of it, stopping smoking, can really help your heart. Yeah. After 10 years, you are half as likely to die from lung cancer, and your risk of pancreatic cancer also decrease. And then after 15 years of not smoking, your risk of cardiovascular disease is the same as a non-smoker. So you're basically going back to normal level of risk factors. So your risk factor for cardiovascular disease is the same for a non-smoker if you stop smoking after 15 years. Okay. So the research is out there. There's a lot of information. I know my patients stop or don't like hearing it, but smoking cessation is a big discussion. If I can bring it up with a patient in my time with them. But that's a big thing. So cutting smoking can really help your heart.
All right, smokers, you heard it here first.
And I would also like to add, not just smokers, but also secondhand smoke can also have the same effect. So if someone around you, if you're not smoking, but someone around you is smoking, especially in the same area as you, in the house, in the house, then your risk factors are similar to a person that actually smokes.
What about vaping? I know that's popular now.
That is so popular, and vaping still is the same thing. And actually, I mean, we don't have a lot of research about what the effects of vaping on the lungs, but it can definitely affect your lungs, and you're still bringing in nicotine into your body, and nicotine has the same effects that if you were smoking a regular cigarette. So vaping, regular cigarette smoking, it's the same thing. And then someone was asking about, what about hemp papers?
I was going to ask that next too.
Yeah. Hemp papers, I think as long as there's nicotine in it, it's going to be the same effect. As long as there's nicotine in there. So I don't know. So hemp papers is a little different, but as long as what is in the actual cigarette, the contents of it, if it's still nicotine, then it's still going to have the same effects as vaping, as regular cigarette smoking.
Right. I think, a lot of people who don't smoke cigarettes or nicotine specifically, but still smoke marijuana and do it out of different methods. Some people break down the cigarillo papers and then they make, so I think that's also where people are like, well, I don't smoke, but it's like, but actually you are ingesting nicotine because you're using those wraps.
Yes.
And so that needs to be cleared up too, is that, just because you're, smoking the herb, the way you're smoking it is the issue.
Yes. Yeah. So yeah, as long as if you're ingesting, if you're smoking, if you're doing the chewing tobacco, whatever it may be, as long as it has some nicotine in it, it is still going to be affecting you and your heart. Yes.
Awesome.
So next thing is eating healthy. There's a big craze about healthy eating. There's, like a huge market about, ways to reduce your weight, to eat better. And heart health, like eating for your heart is important. So reducing certain fats, saturated fats in particular, are very important to helping the plaques building up on the arteries of the heart and other parts of the body. So things like red meats, which are not good for you, full fat dairy products, those both increase, not just those things, but those increase your overall cholesterol levels. So just ingesting those on a regular basis can increase the cholesterol. Eliminating trans fat. So if you look on the label, and label reading is like another big thing, it says partially hydrogenated vegetable oil, and that's usually found in margarines. It's found in store-bought cookies, crackers, cakes, all types of things, usually within some type of like box. And trans fat also can increase your overall cholesterol level.
So since we're talking eating healthy, and like you said, there's a lot of fads on different methods of dieting and eating healthy, and people are doing intermittent fasting now and being vegan now. Although those are methods of eating healthy, should we still talk to our doctors about what type of diet we're thinking about? Because all of our hearts and bodies are different. So sometimes when you take certain things out or add more things, it could affect other things. So should that be a conversation?
Oh yeah, 100%. So there's people who have had gastric bypass surgeries. They are at risk of iron deficiency, vitamin B12 deficiency, because of certain parts of their intestines are cut out to help with weight loss, to help with all, eating smaller. And so those people who've had gastric bypass surgery are at increased risk of iron deficiency, vitamin B12 deficiency, if they're not taking in certain foods. And so still red meat, overall can affect you. But yes, I would recommend talking to your doctor about what diet is appropriate for you. I also would say that, and I'm going to be honest, doctors are not the best when it comes to dieting. Like, we know the basics, but I would say a dietitian or a nutritionist is even better about having that discussion, because they also are aware of, like areas of the body that absorb certain nutrients, certain vitamins. And so they can also give you a tailored diet that you can follow. But yeah, not one diet is for everybody. The keto diet is a big craze right now. Yep. Plant-based is also a big thing, which is good. But yes, not every diet is created equally for every person. So yes, definitely talk to your doctor, talk to your dietitian, nutritionist about what foods are best for you.
Okay.
Yeah.
Thank you.
No problem. So increase the fiber intake, which is another big thing. Like, I do want to bring it up. Pooping is a big thing that I talk about.
We all do it, people.
We all do it. We all.
And I'm actually happy you said that, because there is a misconception with women that we don't poop or something, or if you got to be like very taboo about talking about it. I know women who actually go, or like when they're dating people, like won't use the restroom at that person's house because they are like ashamed of it. So yes, pooping, taking a boo-boo,
yes. Pooping is normal. It is, yes, it's normal. Yes, it can stink sometimes, but I would totally recommend looking at, this is almost like a side, but like looking at your stool, seeing what it looks like, because it really can tell you a lot. It can tell you a lot about your diet. It can tell you if you're not ingesting a lot of fiber into your diet. But going along the whole fiber thing, so taking in soluble fibers, so things like oatmeal, kidney beans, Brussels sprouts, apples. Usually fiber has, like, especially for fruit, it has like the skin, so you can eat the skin. That helps with reducing cholesterol. So it basically takes out the cholesterol through the colon rather than bring it into your bloodstream. So fiber is such a big thing for people to take in. It makes you regular. You're not as constipated. Your poop is not as hard. You're lowering your cholesterol. All of those things you can do by taking in soluble fiber into your diet. So that's also another big one. But yes, pooping is normal. It is. Everyone does it. You don't need to be embarrassed about it. Yes. And it really can tell you a lot about what you're doing, like what foods you're taking into your body. And just think about it, like, we're eating, like we eat to live. And so the foods that we take in really can affect us in many different ways. Stool, like, how your bowel movements is one of them, how it can affect your heart is another. So what you take into your mouth is such a big thing. It's important.
Yes, which is why you should be drinking Teneral Cellars wine, because it's good for you. It has good. We are a sustainable company, organic wine. Let's get it. Let's go.
Yes. So alcohol in moderation. Alcohol is another thing for the heart. Alcohol in moderation is okay, especially in wines. There is something called resveratrol, which is something that can help your heart. 1 glass a day is okay. Actually, 1 glass for women, 2 glasses for men is okay. Anything more than that is considered things that can affect you in the long term.
Okay.
Yes.
Does it matter if it's red or white?
Say it again.
Does it matter if it's red or white?
It doesn't matter if it's red or white. They say that most of the resveratrol is in red wine. Mm-hmm. Yeah.
That's what I've heard too. Okay.
Someone said 1 glass a day keeps Dr. Kara away.
Yes, love that.
Yes. Okay, so moving away from that and moving into like what to talk with your doctor about while at the doctor's office. So usually things that are checked while you're at the doctor's office are your vital signs. So your vital signs are very vital to you. I mean, it sounds basic, but it actually is really helpful. It's really helpful for me as a physician to know what your vital signs are looking like. What is your blood pressure? What's your heart rate? What's your temperature? What's your oxygen saturation? But high blood pressure is what we check when we, when you go to any basic appointment. Checking your blood pressure. And so high blood pressure is considered, and there's different associations for different things. Like the American Cardiology Association actually recommends a lower blood pressure. So below 130, the top number, the systolic, and then 80, the bottom number, the diastolic. So below 130 over 80 is considered normal. So if you're 128 over 79, you're getting close to high blood pressure. But for a lot of other societies, it's 140 over 90, which a lot of people consider high blood pressure. So above those number, 140, the top number, 90, the bottom number, is considered high blood pressure. So if you're having these numbers, if you're going to if you're at your doctor's office and they tell you that your blood pressure is high, we usually can't diagnose high blood pressure immediately. Usually it is it takes a couple times. We need to see, is this a trend of yours, or do you always have high blood pressure?
Is it the white coat syndrome?
White coat syndrome is a real thing. When you go to the doctor's office, your blood pressure can elevate because a lot of people get nervous and get anxious when they go to the doctors. And so white coat hypertension is a thing. So we want to make sure that it's not just because you're being affected by the doctor's office, but that you really have high blood pressure. Yeah. High cholesterol is another, or kind of going with the vital signs. Weight is also another one. So when when you come to the doctor's office, you usually have your weight checked.
Mm-hmm.
And weight is that part. Because we know that, especially during the pandemic, a lot of people have gained some pounds. I mean, me included, I've gained some weight during COVID. I've been trying to work out on a regular basis, but I think that there's, stress involved in continuing to work. Less activity. People are feeling a little bit more scared of like going to gyms and things like that, getting back to their normal activity. And so we've all, gained a couple pounds, the COVID-15 or the COVID whatever. But overweight is considered BMI 25 to 29. And then obesity is considered BMI above 30. And even overweight and obese put you at risk of high blood pressure, of high cholesterol, of diabetes, all of those things. So normal is below 25 normal weight is a BMI below 25. I think it's 21 to 25. And then below that is underweight. But I would say most of the U.S. is not underweight. We are obese. That is, statistics show that. It's good to know. So kind of going back to blood pressure, if you lose weight, so I was looking at the statistic. It's a certain percentage, but I couldn't find it. Every 20 pounds that you lose in terms of weight, you can drop your systolic blood pressure. Thank you. Normal BMI, 20 to 25. You can drop your systolic blood pressure by 5 to 20 points. So systolic, again, is the top number. And you can drop that number by 5 to 20 points by losing some weight. So a lot of patients will come in and they'll be like, hey, my blood pressure is high. I don't know if it's, white coat syndrome. I don't know what's going on, but how can I do this naturally? A lot of people don't want to be put on medicines. And I understand, medicine, like once you're put on medicine, it's hard for you to get off of it. I've definitely seen people get off of it, but it does take some working by yourself, the patient, as well as, working with your doctor. But decreasing your weight can definitely help with your blood pressure. So usually we'll allow like a 3-month trial period. Okay, get into the gym, work out, do whatever you need to for 3 months and see if you can lose weight and see if you can reduce your blood pressure, because that really can help those numbers. I mean, it can help so many numbers. You like weight loss can help with so many different things: diabetes, high blood pressure, high cholesterol. It can help with a number of things. But one of them is blood pressure. That's a big one.
Sounds like we need to start a fitness group for women.
Okay, yes.
so we can all get our minutes in for the week, and also just contribute.
Yes,
to
everyone with
growing.
their, Apple Watches and stuff, or their Fitbits. Yeah,
I'm gonna send you a challenge, Kara.
I mean, we can do a challenge during the holidays, because holidays
we
is
should.
coming up, and we definitely will overindulge. This is the overindulgent time of sweets and foods and cakes, pies, and all types of things. Fitness and wine is what Yellow Sunray is saying.
Yes, we should totally do that, because it just as accountability partners, we always need someone just to be like, now I'm not saying don't have it, but if you do, now we got to go exercise some more.
Yes, yeah, and I'm down for a fitness challenge. I think that would be fun. To help our hearts, to help really activity, fitness can help with so many different things. Your sex life is another big one that can help. So yeah. And then high cholesterol is another. So going back to, what is checked at the doctor's office. So talked about high blood pressure, weight or obesity. So when we do a physical exam, we also will check labs. And so those labs will include your cholesterol, your lipid panel, as well as checking for type 2 diabetes, or it's called the hemoglobin A1C. So that helps us to determine if you have diabetes or not, or what your random blood sugar is looking like. So diabetes is considered a A1C of 6.5 and above. And high cholesterol, there's a lot of different numbers out there, but total cholesterol, you want it below 200. LDL should be below 170. It really depends on where you get the information from, what society you get the information from, but those are kind of the
average.
Yeah, average numbers. So that's what you want to have in mind, and your doctor will let you know, like what cholesterol is considered normal, what's considered abnormal, and ways to reduce that. But those are so high blood pressure, high cholesterol, diabetes, obesity, or overweight can all affect your heart, can all put you at risk of heart disease. So it is important to, get checked on a regular basis. And I know a lot of people are very concerned about going to their doctor's office, especially, during the pandemic. I know a lot of patients that I see in the urgent care, they're like, I haven't seen my doctor in a year and a half. It's hard to get in, or I don't feel comfortable with doing it. But a lot of the prevention, a lot of the things that we check on a regular basis to make sure that you're okay, have been lacking because people haven't been coming in or feeling nervous to come in. So I would say, yes, go to your doctors. It's okay to be seen. Wear a mask. Of course you're going to, but those are all things that are going to help with maintaining your body, maintaining your health, helping your heart, especially.
Absolutely. And I think you bringing up the fact of not going to see your doctor regularly. And I think the pandemic exasperated that even more. One, because we couldn't. But now that we're kind of getting back into that, people need to make those doctor's appointments. You know, you've also been a little more stressed during this time. Your body has changed. All of our bodies have changed in some way. So make sure that you are planning those, if you have not already, to see your doctor. Try to, if you can get in before the end of this year, go see them. Please do. Check up on that body.
Check it on that body. Yes. There's some people that, like, I would strongly encourage you, really strongly encourage everyone that is listening to, go see their doctor. And don't just see your doctor when something is wrong.
Yes.
Because that is what many people will do. You know, they come down with something. I've diagnosed a few people in the urgent care with diabetes because they have not been seen. They've gained weight. Their sugars are out of control, and they're coming in with something called diabetic ketoacidosis, which is an emergency, needs to be admitted to the hospital. But I've diagnosed many people that way because they have not been seen by a doctor in years, and they only come when there is something wrong. And that,
if you have the privilege of having healthcare, use it.
Especially if you have healthcare. And if you don't have healthcare, there are still places out there that don't accept insurance, or, take whatever, that will do a sliding scale. So there's a lot of ways to work around it. Just do a little bit of research.
Yep. And if you need help with that, you can reach out to Teneral, and we will help you do the research, because we want to make sure our community is healthy. So if you need the help and you need the resources, do not hesitate to contact Teneral Cellars through any of our platforms.
Okay.
Instagram, Facebook, all of that.
Yes, Teneral will help you.
Yes.
And so lastly, we will talk about the signs of a heart attack, because we're talking about heart health, and some of us are not coming from a place of being completely healthy, and that's okay. But noticing the signs of a heart attack can really save your life. So for men, it is different than for women. And I was saying earlier when, I first started talking that, it's not really common knowledge that men and women have different presentations of a heart attack.
I've never heard that before doing this heart health situation and looking into it. I had never knew that. I was like, your chest pains and your, whatever they say. That's all I knew. Yeah.
All of that.
Yes.
No.
So, yes. That is very important. Very important to know.
Yeah. I have, so if anyone's just joining for Instagram, I'm talking with Teneral Cellars on heart health, and getting back into it. So men and women present differently. And I did not understand that, or I did not realize that until medical school and residency, more so. And it doesn't make sense because 51% of the population is female. 51% of the population. And so how is it that there is different information, or, why is this information not being said? It doesn't make sense. But so for men, these are the traditional symptoms. So it's chest pressure or chest tightness. Elephant sitting on your chest is usually how a lot of people describe it. Shortness of breath can be associated with it. And then radiation, so pain radiating to the arm, to the jaw. Usually those are the areas that it can radiate to. Sweating can also be another one. So those are kind of the traditional symptoms of a heart attack for men. For women, it's different. Women have different symptoms. So shortness of breath can be one of them. Nausea can be another one. Vomiting can be another one. Feeling really tired or just like not yourself. Lightheaded, dizzy. These are like more non-specific symptoms. Maybe some pressure, but usually it's more of like indigestion. Like, like I'm just not feeling right. I just feel, some like sensation in my stomach, but it's not.
I gotta poop.
I gotta poop. I don't know if anyone will come in with that, but But it's usually something related to their stomach. Like they usually feel in their stomach, and it's associated, with nausea, vomiting, lightheadedness, things like that. And so going to the story of my aunt, because I think it explains it perfectly. She was having signs of a heart attack before she knew it. And the way that she found out, she was, just not feeling well. I think she almost felt like she was having got the flu or a cold. She was feeling fatigued. She just wasn't feeling right. And she was actually watching a Barbara Walters special that was talking about the signs of a heart attack for women. Wow. And she was like, I am having all of these signs. I should go get checked out. Went to the emergency room, was found to have a heart attack.
That's wild. Well, because those symptoms you named, I mean, as a woman, depending on the time of the month, I could be like, oh, it could be, my period, or I'm having a little anxiety, so it can totally trick you into thinking, oh, I'm just a little stressed. I'm just a little, and then it's like you're negating those symptoms to just stress when it's like, no, your body's telling you something.
Your body is telling you something. Yes, really. Listen to your body, because it is telling you something. Now, whether you want to listen to it or not, it's telling you something. And those symptoms, vague as they may be, can be related to a heart attack. So yes, those are the signs, and it is very important. And I, want everyone to know this information, because it can help your aunt, your cousin, your mom, your dad, whoever it may be, to get checked out if they really need to. If they're really having these symptoms.
Yes, I also saw in my research that a lot of women miss out on these diagnoses also during pregnancy or after pregnancy, because there's a lot of hypertension and stress and high levels of, your body hormones are changing, and you're just like, oh, my body's changing. But that there's actually a huge correlation with a lot of women with heart hypertension, and diabetes during and after pregnancy.
Oh yeah. So if you are, so the question was about diabetes and hypertension in pregnancy, and so there are a couple different things, but gestational diabetes is usually diabetes that is diagnosed during pregnancy. I don't think it's called gestational hypertension, or maybe it is called gestational hypertension. But you can also have chronic hypertension, or high blood pressure. So even before you get pregnant, you can have semi-high blood pressure that once you get into pregnancy becomes high blood pressure. So I mean, during your visits with your OB, they're going to check your vital signs, and the vital signs again are very vital. And can help to diagnose high blood pressure and put you on medicines to help with high blood pressure, because you do not want to have high blood pressure during pregnancy. You can have something called preeclampsia, which is high blood pressure plus other things during pregnancy. You can have something called eclampsia, which is an emergency, basically where you have seizures during pregnancy. And a lot of that is precipitated by high blood pressure. So you definitely want to get checked out. You definitely want some prenatal visits, or visits during pregnancy. And after pregnancy, because diabetes can be diagnosed that way. High blood pressure can be diagnosed and treated during your time being pregnant. And this cannot just affect yourself, your body, as a pregnant woman. It can also affect the fetus, the baby that's living inside of you. So big babies, large babies are usually a product of are a product of diabetes during pregnancy, especially if it's not treated. Yeah.
Never heard that.
Yeah. Yes. Or not enough blood flow going to the fetus because you have high blood pressure. And usually, I mean, maybe I should have talked about this before, but high blood pressure is constriction of your blood vessels. So they're kind of clamping down. to get blood throughout the rest of your body. But if it's clamping down, it can also affect the blood flowing to the fetus. So yes, you need to get checked out when you are pregnant, because the conditions, diabetes, high blood pressure, other conditions, not just these, should be diagnosed and treated appropriately if you have them.
And you know, I think that's super important for women to hear, particularly how we were saying earlier, listen to your body, know your body, because if your body is changing very drastically during pregnancy, you should be able to have a baseline to know that that's what's happening, and it's not necessarily just related to the pregnancy, but there could be other things that you know are not normal because you've been monitoring your body before that. So as women, you know, we really need to listen to ourselves, our bodies, our minds, our guts, because our bodies are always talking to us, and we just keep moving every day. So stick to listening to your body, and if you haven't already, start.
Yes. If you have, and I think it's a learned habit. You know, like I think that we can get off, not attuned to listening to our bodies, and so I think it's just slowly getting back into it. If you're not listening to your body, listening to what your symptoms are, and really getting checked out. And you know, nothing is stupid. There's a lot of patients that come in and like, oh, you know, like, I'm sorry to waste your time, and I'm like, you're not wasting my time. Like, you were concerned about something. Let's see what's going on. If there's nothing going on, then great, but let's make sure that there's nothing going on. So no visit is stupid. No visit is unnecessary. If you have a concern of something going on in your body, get it checked out. Really, get it checked out. And then one thing I have not said, which is also a huge risk factor for your heart, can affect your heart in major ways, is cocaine use. Cocaine is a hell of a drug.
Yes.
And it can affect your heart. It increases your cortisol levels, and cortisol is the stress hormone. And so it can make your heart beat faster. It can make your heart beat harder. And so there are some people who are not the normal age of a heart attack. You know, they're not the 50, 60, 70-year-old male. They're a young 20-something-year-old person, female, that's coming in with heart, you know, chest pain, because they've been doing a lot of cocaine. So cocaine is also another big thing, especially for young people to watch out for, because it can affect your heart in a big way.
Yeah. That's a big one, because, you know, when you're young, you don't care or think about your body in the same way that you do after you turn 30 and your knees start to crack every time you get out of bed. But yeah, you know, that carelessness of just having fun and partying and thinking like, oh, you know, it won't affect me. It can catch up with you even at that age. So
even at that age, yes. Not catching up to you later in age, catching up to you now in age. Yeah,
absolutely.
So cocaine use is, you know, it's not a good drug, because it does have a lot of effects, and mainly affecting your heart. It can also increase not just heart attacks, so you're at risk for heart attacks, but also high blood pressure. So people who are like regular coke users also have increased risk of high blood pressure, and you know, other things that come with that.
Absolutely.
Yeah.
Awesome.
And that is it that I have.
Awesome. All right. Well, I just want to say, I just want to say thank you so much. You gave so much great information that I think is enough for people to start the journey of exploring their heart health and checking in with their doctor, making an appointment. So these are our asks for you right now. One, if you haven't made an appointment with your physician, please make that today.
Yes, make an appointment with your physician today.
Yes, most physician offices now have an app where you can do it straight through an app. So if you have that, do that. If not, call right now. Also, if you are a woman, listen to your body. Well, everyone listen to your body.
Everyone.
But particularly
every person, yeah.
But I'm particularly saying my female identifying people in my people who have menstrual cycles and all of those things. Pay attention to your body when you're not in that cycle. Well, you're always in your menstrual cycle, we know that. But when you're not bleeding, because that's when we tend to pay attention. Pay attention to your body outside of that. And then thirdly, we want you to support women's reproductive health, heart health, breast health, all of those things by purchasing a 3-pack from Teneral Cellars, from our women's health pack. And each 3-pack that you buy will help us help the Endometriosis Foundation of America by donating $10 from every one of those packs back to that foundation. And then if you want to continue to support women, you can buy any of our Teneral bottles because they all support women, because every level of our business is a woman-owned business. The label makers, the bottle makers, the sommeliers, the CEO, everyone. Dr. Kara's on our board. So yes, just every purchase, even outside of those 3-packs, is supporting a woman-owned business in some way. And so continue to do that by going to teneralcellars.com and getting your bottles ASAP. And I just want to say thank everyone for joining us here on Facebook today and Instagram. And we appreciate you. And we will be back again on October 27th with another talk about breast health to end off our beautiful month of October. And we all know what October is. And if you don't, I'm going to challenge you to go Google what October is. Okay.
Yeah, definitely do that.
Because you should know. But Dr. Kara, is there something you want to say to the audience before we go?
You wrapped it up beautifully, and I don't have much else to say, but thank you for listening. Yeah, definitely take care of your heart, because it is something that you need to last. You know, you need it to continue working properly. So take care of it. Go see your doctor. Go make an appointment, because people are taking a longer time to get appointments with their doctor. So make it today so you can have it in the next few weeks, month, 2 months, if that's where your doctor is.
Yep. So thank you again, Kara, and to everyone, have a wonderful weekend and stay healthy.
Stay healthy. Yes.
Thank you.
Thank
Bye,
you.
everyone.
Bye.